will be performing an IV push today. I have my physician's orders and my MAR. I will compare them together. I will look at the patient's name on both documents. I will look at the medication, the dosage, the rate, and the route. I'm giving furosemide 30 milligrams IV push every 8 hours. I will also look at the allergies, and I see that my patient is allergic to penicillin. I will then take the MAR and compare it to my medication. My MAR says furosemide, and I have furosemide. I will also check my expiration date, and it expires April 2020, so it is not expired. Next, I will check and see if it's a safe dose in my book, and it states 20 to 40 milligrams may be repeated in 2 hours. If necessary, increase dosage by 20 milligram increments until desired diuresis is obtained. So this is a safe dose. Okay, so with the dilution, it says that I do not have to dilute furosemide, but if I was giving it through a Y tube or a 3-way stop lock of infusion set, I usually could. It's not usually added to IV solutions, but large doses may be added to normal saline, lactated ringer, and D5W and given as an infusion. Next, I will check my compatibility, and my patient has D5W running, so I'll see if it's compatible to my furosemide, and it is compatible. Next, I will look at my administration route of administration. The book states each 40 milligrams of infraction thereof should be given over 1 to 2 minutes. My furosemide, I should be giving 3 milliliters over 2 minutes, but I am going to administer 1.5 over 1 minute. Next, I'll be checking some precautions to monitor. I will monitor my blood pressure frequently. I would do routine checks of my electrolyte panel. Bun are necessary during therapy. I would do my electrolyte replacement. I would check my blood glucose because it may increase your blood glucose. I'll do AccuChecks. I'll periodically monitor the CBC and liver function tests. Also, it may lower your serum calcium level, so I will check for a technique with that. And some pertinent labs that I would do is my bun and creatinine and potassium. I will check with that. Let me grab my watch real quick. Okay, so everything checked out with that. Okay, so next I'm gonna gather my equipment. I have my medication. I have my syringe. I have my medication label, and I have my alcohol. So I am going to wash my hands. Okay. Next, I would clean the top of my medication for 20 to 30 seconds. Okay. Next, I would open my syringe and I will inject 3 milliliters of air. And I'm going to draw up 3 milliliters of furosemide. I'm getting the air bubbles out. Okay. Alright. Okay, so next I will label my syringe. I will place my patient's name, which is Janet Green. The drug, which is furosemide, 3 milliliters is the amount. Prepared date, which is today's date and time. Prepared by me, Chelsea Banks. And the expiration of the furosemide is April 2020. Okay. Okay. So once I do that, I'm going to gather my MAR and my medication, and I'm going to go into my patient's room. I am going to introduce myself. I'm Chelsea. I'll be your nurse today. I will ask her her name and date of birth while I'm looking on her armband. And I'll ask her if she has any allergies, and she stated she's allergic to penicillin. Okay. So after that, I will let her know that, and also her information that she stated and on her armband is also on the MAR. I will inform her, well, I will let her know that I'm going to be giving her 3 milliliters of furosemide. It's a diuretic. I'm going to be giving it to her IV push. And if she feels any type of discomfort or pain or irritation, anything, let me know so that I can stop pushing it. Okay, so once I do that, then I would wash my hands. Okay, so now I'm going to check for redness, infiltration, edema, any signs of infection. I don't see any. I'm going to check my solution, and it is D5W going. So I'm going to check to make sure that the IV line is patent. So I'm going to hold it below the level of her arm, and I do see blood, so it is patent. If I was to be doing, if this was an IMT, I would be having gloves on, but since it's not, I do not have to have gloves on. Okay, so next I'm going to wash my hands again. Okay, so next I am going to locate the port that I'm going to inject this in, and it's going to be the port closest to the patient's IV. So it's going to be this port. I am going to clean my port 30 seconds. I'm going to remind her that as I am pushing this, if she experiences any type of discomfort, to let me know so that we can stop. Also, before I'm giving her this, I am checking for the 5 rights of the medication. Alright. So I'm going to clamp. Well, first I'll place my medication on the syringe. And I'm going to clamp this tubing. And I will be pushing this over 1.5 minutes. I'll be pushing this over 1.5 minutes. 1.5 minutes. Hold on one second. Okay, I will be pushing 1.5 milliliters over 1 minute. All right, and I'm ready. Okay, that's the first 1.5 milliliters. I'm gonna wait a minute. Okay, next I'll be clamping my tubing again and administering the last 1.5 milliliters over a minute. And I am starting now. Okay, I release that and I'll unconnect my tubing. I will discard my equipment. I will again inform the patient to not get up because she may experience some dizziness. So if she needs to go to the restroom, to please call out so we can get her some help. The IV site looks good. It's not red. It's not. It doesn't look like it's infiltrated. She's not complaining of any pain. So that's all with that. My bed is at the lowest level. My bed is locked. My call light is in reach, and my rails are up ×2. And I will now document. And thank you.